So when I was a kid, I went to the dentist. Now, I have been to the dentist since then, but this particular story, though, took place many years ago. And the dentist did some procedure on my tooth, and he asked me, he said, "Does that feel right?" I was nothing if not obnoxious, and I ran my tongue over my tooth. But I said to him that, don't you have any kind of device that you can just use to see if this feels like it's supposed to? And the dentist gave me a rueful smile, and he said that there was no device he had that could tell better if the tooth was done correctly than my own subjective sense of it. Obviously, that story has stuck with me. And over the years, I've come to realize that's actually true of a lot of things in life, things that are trivial, but also things that are important. If I see you eating a chocolate bar, if you see me receiving a hug, our best knowledge of how that experience is for us comes just by asking each other. To get myself pumped up for this TED Talk, I watched interviews of the nature boy Ric Flair. If all you did was measure my physiology when you heard him go, "Woo!" you wouldn't know whether I was excited or scared. Maybe it was a bit of both. You'd have to know by asking me. Even just now, by hearing the words coming out of my mouth, listening to me talk, I'm changing your brain. And you're doing the same to me. By knowing that there's an audience for this TED Talk, you're changing my brain. But there's no brain imaging device in the world that can compare to our own introspective answers of what this experience is like. So introspective answers are often our most accurate answers. But is that true for psychotherapy? So let's imagine Denise. Denise is a 38-year-old Black American woman. And with the pandemic, she's been out of sorts. She's not getting enjoyment out of things she used to, not even when she interacts with her family. She feels more tired than before. And she just doesn't have the same kind of energy levels. Denise decides that she wants to go to a therapist. But she wonders, will therapy work? If you've listened to people like me, I'm a licensed psychologist. If you've listened to people like us blather on before, you've probably heard us say things about how therapy and psychology are grounded in rigorous empirical science. And that's true. There's a large body of research that shows that therapy works. It helps people with mental health problems, particularly compared to not doing anything about them. There's a separate body of research that seems to show that some therapies work better than others for treating certain mental health problems. We call these evidence-based psychotherapies. So there's over 600 brands of psychotherapy out there. But only around 80 are designated with the label evidence-based by the Society of Clinical Psychology, which is a division of the American Psychological Association. The Society of Clinical Psychology makes this list publicly available and very transparently provides the evidence, the citations for the research that they think is key to saying that these therapies are evidence-based, they work better than others for treating certain psychological problems. So if Denise is going to a therapist and the therapist and Denise talk, and it turns out that Denise has clinical depression, the therapist may suggest that they use an evidence-based psychotherapy to treat that depression, like interpersonal therapy or cognitive behavioral therapy. So can Denise have faith that that works? Do we really need introspection to know if it works? The evidence says it works, right? Maybe things aren't so clear-cut. In the last decade, psychologists have had to grapple with the realization that many of our most cherished research findings are not as pristine as we once thought. It started about a decade ago. Some psychologists seem to know it before then, but for a lot of us, it seemed like it was a decade ago. There was a famous psychologist who published a study in a very reputable psychological journal that seemed to show that current events could influence the outcomes of past events. current events could influence the outcome of past events. That's like saying if Patrick Mahomes was playing tonight and threw for a touchdown, that would affect whether Kansas City won the football game last Sunday. That doesn't pass the smell test. That doesn't really make sense. And psychologists were taken back by this, and many psychologists tried to replicate the findings. That is, they ran similar experiments to see if they could get similar results. You're probably not shocked to find out that they couldn't. No one could. So what happened here? That's what the question became. How did this psychologist publish these results in the first place? There was no suggestion, no evidence that he had in any way committed fraud. So what happened? Well, in analyzing his research methods, and then in beginning to look at other famous studies in psychology, psychologists begin to realize something that's also been realized in other disciplines, in physical medical care, in biology, in economics, in political science, that oftentimes research designs lend themselves to false positive findings. That is, oftentimes research is set up to suggest that phenomena exist when they actually don't exist. I'm a psychologist, so I pick on our field here, but this was a shocker. Psychologists begin doing wide scale replications of lots of previous psychological research. And they found that only about half of the psychological studies they attempted to replicate replicated. When they would follow similar experimental procedures, they wouldn't get similar results half the time. To try to figure out the scope of this problem, psychologists also began to look at past bodies of research and statistically analyze them to see if there were problems statistically with the credibility of past bodies of research findings. That's where my colleagues and I became interested. We want to know, for the evidence-based psychotherapy literature, just how credible is that literature? So we conducted meta-scientific reviews, statistical reviews of the credibility of past bodies of psychological research on evidence-based psychotherapies. The most notable of these, we ultimately published in the Journal of Abnormal Psychology. Those 80 therapies that the Society of Clinical Psychology designated as evidence-based, we examined the research cited for them to prop up that evidence-based designation. Altogether, we analyzed over 450 research reports across a variety of statistical metrics. So for instance, we looked at how big were the samples in these studies. In general, the more participants in a therapy trial, the more we could trust in the results. We also looked at things like statistical misreporting. So if a given study said 2 + 2 = 7, we knew there was something wrong with at least one of those numbers. Taken together, our findings were pretty eye-opening. Around 20% of evidence-based psychotherapies performed well across the majority of our metrics. That is, they had strong evidence of credibility. Around 30% were a mixed bag. They fared well on some metrics, not as well on others. You don't need to be a math major to realize that that leaves 50%. 50%, 1 in 2 of the evidence-based psychotherapies we looked at, fared poorly across the majority of our metrics. That calls into question the credibility of the evidence cited for them as being evidence-based. So is all hope lost here? Are the Denises of the world receiving therapy, or any of us who are interested in therapy, pursuing therapy for ourselves, thinking about pursuing therapy in the future, are we screwed? Fortunately, we're not. For one thing, the research that my colleagues and I did does not have any bearing on that large body of research showing that therapy works. It works for people who seek it out. We simply looked at whether there's credible evidence that some therapies work better than others. That's different than whether or not therapy works at all. It does. Secondly, psychologists are taking advantage of this moment. Some have called it the replication crisis because of those failures to replicate. I prefer the term credibility movement. And that's what a lot of psychologists use to describe this. We're being proactive about it. So a lot of therapy trials and other types of studies being done now are trying to correct and use different, better research designs that significantly decrease the probability of having false positive findings. So that's good for the future Denises. But what about today's Denise? What about those of us who are giving therapy, in therapy now? What can we do? Introspection can be our saving grace. Kind of like in the dentist office, there's oftentimes no better measure of how therapy is going than just by asking the patient or client about what they think. This can be done informally, the therapist and patient sitting down together, talking about that on a week-by-week or bi-weekly, monthly basis. Are the patient's symptoms decreasing? Are they reaching their goals? It can also be tracked introspectively, but more formally. There are simple pen and paper measures that clients can fill out in a therapy session, oftentimes in less than 2 minutes, that can help track their symptoms over time. Those measures ask them to reflect on how they're doing, and it helps quantify it in some way so that we can see over time, are their symptoms improving? Are they reaching their goals in therapy? If you're somebody out there receiving therapy, or you're thinking about therapy, and you want to make sure that introspection is being used well, what can you do? You can ask your therapist 2 questions. How will we know therapy is working? And what will we do if it isn't? A good answer will not simply be the therapist saying, I'll tell you these things. A good answer will involve the Denises of the world, will involve any of us. Introspecting and reflecting, these introspections and reflections being tracked in some way over time, and the therapist and the patient deciding together on the directions that they want therapy to go, deciding together if it's working. That's what can help Denise. That's what can help all of us interested in therapy. And it can help us in the dentist office too.